But joining us now is Elaine Parker. She is Senior Communications Vice President for the Job Creators Network and the President of the Job Creators Network Foundation. She is live. She is in Florida, in Orlando area, and she's with us now. Elaine Parker, great to have you.
Hey, John, thanks for having me.
I was so happy to get a Florida update from you. Couple little housekeeping issues. Ann, I, and Joseph will be in Sanford, right? Remember that. We go to the World Series tournament there with his team, the Richmond Braves, and we will be there on Friday, Saturday, and Sunday. I think that's the end of July 23rd, 24th, and 25th. They stay through Wednesday. I have to leave Sunday night to get back to D.C. for an event there with Steve Mannon and folks. But hopefully we can hook up that weekend.
Absolutely.
So put it on your schedule.
It is on my schedule, but you know that it is extremely hot in July down here. It's unbearable.
Well, here's the good news. Joseph is a hot weather pitcher. Hotter it gets, the tougher he is. So I hope it's 105 when he pitches, because he doesn't do good in the, it's like 50 degrees. He doesn't do that well. But you turn that temperature up to 90, 100, he's unhittable. So I'm for the heat for that weekend at least. Elaine, let's talk about the Florida situation. So you're testing 200,000 people a day or something. I mean, it's some enormous number. I think you tested 155,000 on Sunday in Florida. Anybody that wants a test just walks in and gets one. There's no restrictions on it. Don't have to have symptoms. So you got all these positive cases, and the media's hair's on fire, and they're trying to cancel the Republican convention in Jacksonville, and they're saying everybody's going to die, body bags and cul-de-sacs. But then you look at the death numbers, and the percentage continues of those with cases continue to decline, and the actual raw number of people under 85 is stable. But yet, if you look at any single headline, you would think that Florida people are falling, dying on the road. What is going on there? Yeah,
John, I mean, the media has done a fantastic job at scaring the public. They're very good at those headlines. And I'll be honest with you, when I heard the headline of over 15,000 cases on Saturday, I thought, wow, I mean, that's just an incredible number. And so I did my due diligence, and I went online and I looked at the press release put out by the Florida Health Department, and lo and behold, it was a record number of tests in one day. In one day, you're talking about over 140,000 tests. I don't think there's another state in the country that's testing at the capacity that we are. And 15,000 of them were positive. But when you look deep into the numbers, the positivity rate continues to fall. That was the third day in a row. Yesterday, we had the second highest number of tests, or Sunday, it was 112,000 tests. And again, the positivity rate continues to fall. But what is important to look at is the people who are getting sick are either asymptomatic, most of them are asymptomatic, or have very few, light symptoms of it. But the media is scaring everyone so much. They do these drive-through tests. At the Orange County Convention Center is one of the drive-through places down here, and it's a very large facility, so it can handle a lot of testing and a lot of cars lined up. People line up at 4 o'clock in the morning because they're so scared, and they wait all day to get a test. And that's because of the fear that is being driven by the media. And what we need to do is really look at the numbers and understand the context of the numbers and how they're being driven up, much to do with the increase in testing.
You get 150,000 tests, 15,000 people get it. So what you're saying is the rate, the percentage of those that have it to cases, not the number. The raw number is going to go up, but you're saying the percentage of people that have it via those tested is going down.
Right. The COVID positive rate is on a downward trend. It's still in the higher territory compared to some other states, but it is on the downward trend, and a lot of it is being driven, a lot of the positive tests are being driven by the immense increase in testing and the fact that Governor DeSantis is really going into populations and being very aggressive about testing, which is a good thing. I mean, he's done a fantastic job for the state, but he's going into communities that aren't normally testing. And migrant workers and areas where, migrant workers, you tend to find that they live in small spaces and all together. But, even if you look at the deaths across the state, I mean, we're a state of 22 million people. We've had 4,200 deaths, but 50% of them have been in long-term care facilities. So we know where the vulnerable populations are, and we need to protect those populations. We need to have, as many resources as necessary to protect, our grandparents and the elderly that are in nursing homes. But the bulk of the deaths in Florida have happened in nursing homes, and frankly, not that many when you compare us to New York State.
So you've had all these people that are positive there. You've had a total, it was what you're telling me in Florida, Elaine, a total of 4,200 deaths that are coded as COVID-19, right? That's your total.
Correct.
And 2,100 of those, half of those are in long-term senior care facilities or nursing homes, if you will. 2,100 of them have been in nursing homes. So basically, you got 2,100 out of, I don't know, how many people have tested positive there? There's got to be like tens and tens and tens of hundreds of thousands.
Oh, you know what? I don't have the overall number of positive
it's got to be a huge number. So
yeah.
the point of the matter is, what the media will do is they say, cases are up, everybody's going to die. Then they go to the death number and they say, well, deaths in Florida have continued to go up for 5 days. Oh, my God, it's all going up. But they're going up by like 3 or 5. Like they went from 35 to 38 to 41 to 50. And again, 50% of these are in nursing homes. And 90% of the people that test positive are asymptomatic. They have no symptoms. They don't even have a runny nose. Nothing, zero. But yet they're being scared into getting a test. So I go there, I go to Orange County, I get a test, I have no symptoms, I'm positive. Okay, now what do I do?
Go home and isolate. So you don't spread it, but you don't need to be hospitalized in that case. Look,
you have no symptoms. So you have no symptoms. You're not in the hospital. All right, so you stay home. You don't want to get other people that have it that could have symptoms. But then the media is saying the hospitals are overrun. Okay, based on what? Then you look into the numbers and you find out in your healthcare system in Florida that 72% of the available COVID beds are not utilized. So you're at 25% capacity. So you still got 75% that are open. But yet you have the media headlines saying your hospitals are getting overrun. What hospital's getting overrun in Florida?
Look, the increase we've had an increase in COVID hospitalizations and ICU admittance, but it's not all COVID patients. What you need to remember is that we had a complete shutdown of elective surgeries.
Thank you.
and for your audience that doesn't know what elective surgery is, it's not somebody who decides, hey, I'd like to go get a nip and a tuck. It simply means that they have a scheduled procedure, whether it's a mastectomy or a heart valve replacement. I mean, these are life-saving surgeries that were literally put on hold because they're scheduled. Now, the people who came through the door having a massive heart attack and needed surgery right away, they got their surgeries during the COVID shutdown. But if you had a scheduled procedure, you did not get your procedure. Those people are sicker now. There are other people who didn't get diagnostic testing and screening for cancer. So there are the cancer diagnoses are down. We have to look at the total consequence of all of the shutdown, not just the virus and how it's impacting the population, but we have a population that wasn't getting treatment. So a lot of in some cases, the ICU admissions, as much as 75% or more, are not even COVID related, but it's reported that ICU admissions are up. And one more point to make about this, John. Hospital ICU departments typically run at almost full. They actually need to function properly, to be staffed properly. Hospitals, much like hotels, have to run at a certain level of capacity. You don't want to go into a hospital that only has 30% or 25% capacity. They're not going to be staffed up enough and ready. So they have to run at 70% or 75% capacity to ensure that they have enough staff ready if there's a sudden surge so they can be prepared. these hospitals actually need more staff.
Yeah.
Because so many were laid off during the shutdown.
The fake news, I mean, is just, it's gone beyond the pale. This is all about Trump and Biden. This has nothing to do with reality. And you look at the headlines in Florida. I told you off air yesterday, I was at a baseball tournament over the weekend, and you know those things pop up on your phone, like I subscribe to a bunch of them, Politico, The Hill, Roll Call, right. Wall Street Journal, whatever, New York Times, right, Washington Post, they pop up. And every 5 minutes it popped up about Florida cases, death, dying, body bags and cul-de-sacs, hospitals overrun, all lies. I mean, they just make this stuff up. And what you just said is absolutely correct. Of course hospitals are filling up because people haven't had their surgeries for months, and now they're going back in and some are getting sick. Has nothing to do with COVID-19. When you look at the COVID-19 beds in hospitals, there's 75% are still available. That's why we did the lockdown, not to overrun the COVID-19 ICU beds. Well, they're not being overrun. The fake news can't even talk about ventilators anymore because they're shipping them overseas. They're stockpiled. There's no utilization of them. So you're getting this constant mantra of fear in Florida. Now, what about Oklahoma? See, they covered that for 2 weeks when the rally was there. Now that's stopped. I haven't heard. Have you seen anything on Oklahoma? No. Washington Post sent 15 reporters there to find people who got sick. They found one, Herman Cain. Sorry, he'll be fine. Right? Now, look, if the Republican convention, Elaine, was in Albuquerque, New Mexico, every single story the fake news does every day would be how many people are going to die in New Mexico. So, I mean, we're not stupid. This is all fake, and what you just said is the hospitals have to fill up their ICU beds to make money. They're profit-making businesses. Unbelievable, the level of false information, and yet we get banned. So we'll put your interview up, and it'll get banned. I'll get banned from Twitter or something because of what you said, which is based on fact. Unbelievable.
We have no context for what it means in a hospital capacity. You know, we as regular citizens, we don't know. We're not in the medical field, and we don't know that hospitals have to run at a 70% capacity, and many times ICU beds are 90% full. But the reason why, obviously, is because people are sick, but it also is because they have to run at a certain capacity to actually have the revenue to staff up and be ready for surges in whatever it might be. If we have just think of it as similar to a hotel. I mean, they have to have enough staff there to run a hotel, so they have to have the capacity. Otherwise, they're not going to be able to serve the people who are there.
Unbelievable. John Fredericks Radio Network, it's when you get the truth from someone like yourself that's there, and you juxtapose it against what the fake lying media does on a daily basis, it's shocking how this country survives with this. It's just, you get off the air every day, and I just shake my head at these headlines, which are complete lies, every single day. And what they're going to attempt to do is they're going to keep this up in order to cancel the convention in Jacksonville. That's what this whole thing is about now, Elaine, in Florida. And I'll tell you something else. There'll be more people protesting in Jacksonville without masks and without social distancing than is at the convention. And the fake news will not say a word about that, right? That'll be fine. If you protesters don't get COVID-19, they don't spread it somehow, but those that are going to the convention will. I'm being one of them. And it's so ridiculous. John Fredericks Radio Network. We're with Elaine Parker. She is Senior Communications Vice President with Job Creators Network. She's also the president of the Job Creators Network Foundation. Elaine, let's get to opening schools. Now the villain is Betsy DeVos and President Trump because they want kids to get educated. And every poll that comes out now, 58 to 60% of parents want their kids to go back to school. Yet, we got the fake news saying we have to close schools. We got teachers' unions saying we can't go back into the classroom, we might die. How do you frame this? What is going on?
I'm just going to give you one quote from one of the most prestigious organizations in the country. The American Academy of Pediatrics has announced that safe in-person schooling is the best option for kids. The organization says it, quote, strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school, end quote. That says it all.
Mm-hmm. I mean, you have to go to school. And kids don't get it. There's evidence showing right now that they don't necessarily spread it either. But even if you do spread it, if everybody is asymptomatic, I mean, what does it mean? I mean, if you and for the 10% of people that have symptoms, they're mild. And there's a couple percentage that they're in bed for 3 days and they eat chicken soup. You go to the number of people dying that are under 85, it is a minuscule number. And almost every one of those people who have died from COVID-19 under 85 have underlying health conditions. If you have that, you should protect yourself. No question. I have friends of mine that are way overweight, more than me, not as healthy as I am, asthma, things of that nature. You know, they have to protect themselves. So don't go out. Put a mask on. Do all that stuff. Hazmat yourself. But for 99% of the population, this is a cold. And yet the fear has stifled the economy, and now we're not going back to school.
Look, the current data certainly has suggested here in the U.S. that children are both less likely to contract or spread COVID. And if they do get it, like you said, they're going to be minor symptoms. But I've looked at two studies. One is the National Institute for Public Health and Environment in the Netherlands, which looked at kids, and they determined that children really play a minor role in the spread of COVID among children. And from kids to adults, they found is much less common. And then there was a French study that backed up the same conclusion that it's much less likely for kids to spread it to adults than for adults to spread it to children, which was an interesting conclusion in general. But it certainly shows that if we do send the kids back to school, and we should, and we social distance and do the right things that the CDC is recommending, that we can keep the spread low, we can keep our kids in school, because the detrimental effects to keeping kids out of school, I mean, we've seen a rise in child abuse, and many times low-income kids, the only meals they get during the day are the ones they get from school, breakfast and lunch. So, you know, we've got to get these kids back in school. And for some kids, not going to school every day means no school at all. They're not getting an education at home. My brother has an autistic son, and they're in Georgia. So for the time that Georgia was shut down, he was not in school, and he regressed. So when you think about kids who have learning disabilities or autism, those kids can't learn online. They can't distance learn. It's not even an option. They need the interaction and the direct contact with their teachers. And he's back in his special classes for autism, and the improvement has been incredible because he's getting direct contact with his teachers. They're taking the precautions they need, and he is back on track. But it's very devastating to watch your child regress like that.
You know, to look at your kids not going to school, sitting home again, doing Zoom, 30% don't even get online. You know you're not learning anything. You get a pass-fail grade. You can't participate in athletics. You cancel high school football. You cancel baseball for the fall, soccer, lacrosse, whatever they're playing, cross country, that's gone. You wipe all this out, and it's only for one reason, and that is keep kids home, keep mom and dad depressed, keep them from going back to work, beat Trump in November. That's it. I'm telling you, Elaine, if we have, God forbid, if we have President-elect Joe Biden, Fauci and Birx and the whole bunch of these people will come out with some all clear within 5 days. They'll find some new study. They'll justify it, and somehow schools are back, football's back, basketball's back, everything is back. Go back to normal. Life is good. There's no question this is going to happen. And people are not this dumb. They are starting to figure this out. That's why the polls are turning in Trump's favor now. People are figuring this out, Elaine. No question. Couple stats here. If you look at the percentage of deaths in Florida to the population, okay, it's 99.8%. 99.8%, no problem. So you got 0.02% have died of the population. If you take out those in nursing homes, the percentage of Floridians who have died from COVID-19 not in a nursing home is 0.001 or 99.99% of residents of Florida have no problem with COVID-19, and the death rate is the same as regular influenza that people die from every year. So the stats they're giving us is a complete bold-faced lie to scare people, to tank the economy, don't go to school, don't go to the convention, beat Trump. I don't know why else they would do this. Do you have any idea why they would lie to this extent?
I don't, but as we continue having states that push to reopen and people are pushing back, and I don't believe we're ever going to see a full shutdown. I mean, I just don't think Americans are going to fall for that. And I think they're going to push through because I think we all have, at least children for sure, have a greater chance of dying from influenza than COVID. But you may be right that the numbers are moving back in Trump's favor because I saw a Facebook post on Joe Biden's Facebook page. Now he's claiming that he sounded the alarm bells for COVID back in January.
Oh, the same guy that called Trump a racist for shutting down flights coming from China? That Joe Biden?
Yes, that same Joe Biden. I mean, does he think that we all are having memory and cognitive problems? Because there's no way that he sounded any alarm bells in January.
But it doesn't matter. It doesn't matter because the fake news will make the stories up and put up headlines that are deceiving. And so the fake news would just make it up. They're like his offensive line. In fact, what they are now, what the majority of these so-called reporters are, is they're part of the DNC operative machine. They might as well be working for the Biden campaign. The fake news is just so rampant. Elaine Parker, thank you for being with us, Job Creators Network.